All right, so we have a viewer, Miss Meikle. I hope I did not butcher that name. So, age 22, and she has a question, and her question says, "Good morning. I'm currently studying economics at UA. I want to become a health economist, and this I need some experience in the health aspect. Which certification do you think is best suited to provide me with the knowledge of the healthcare system?" All right, so there are two ways I can answer this for you. Right? One, Miss Meikle, one, you technically don't need a certification. You can get a letter to, similar to how persons do work experience, you can get a letter to have that work experience extended to the healthcare facility. So you can basically be around to see how it works. Best thing to look on, especially when it comes on to the overall healthcare system and how it works, you want to go not into the field where you're doing the doctor work and the nurse work. You want to go more into the administrative field where, since you're doing the economics aspect, you want to say, okay, how do they do pricing for the various services? How they do their hiring, how they do their payroll, how they do their management, how they do the utilities, how they get the equipment. But those things are more aligned with the economics aspect for you. So that is one thing. You can actually get a letter from your school, which would be you in this case, to say, hey, this is a student who wants to do this, and allow her to basically shadow. You can talk to the persons who work the admin aspect for the healthcare facility, so you can actually have that area dealt with properly, because you don't want to go into the nursing and doctor work. You want to go into the administrative work where you deal with the numbers aspect for it. So that is one way you can do it. Another way you can actually do it without getting the certification is that you yourself can actually approach a healthcare facility, speak with who is in charge, and say, hey, I am this, I'm doing this, I need your assistance, or could you facilitate me maybe questionnaire, shadowing, maybe doing some hours. And that's another thing you can do, doing some hours. Internship helps. So you're doing some hours to say, oh, here, this is how we do the billing for the insurance company. This is how we do the billing for the practitioners or the persons who need care. Right? That's one way. So you can do the letter from the institution, or you can approach. So you can do it like that. And then from there now you can then approach. But my first suggestion, either try the letter from your institution, or you approach one of these health facilities.